I'm really excited to be doing this, both as part of this collaboration between Reporting on Health and AHCJ, and just to give folks AHCJ's website, which will have the same information about this webinar as Reporting on Health. It's healthjournalism.org. This information we're going to discuss today is not just relevant if you are a reporter in California. Health data and information about hospitals and their finances and how hospitals use services are collected in almost every state and are available publicly if you know how to ask for it. And so what I'm hoping this webinar will show you is some of the things you can look for in this data, how it's relevant to writing stories that you are interested in, but also to keep your community and the neighborhoods you cover in the loop about their hospitals and whether they're delivering the services that your communities have come to expect from them. So while Ashpit is in and of itself primarily helpful for California journalists, these type of resources are very helpful in other states. And I hope those of you who are not from California, will take away good questions to ask. As I looked at the answers that you guys wrote about your experience with Excel, it looks like most of you have the ability to navigate a spreadsheet and sort data, and that will come in very useful here. A number of you have a more moderate or higher level of Excel knowledge. So if I'm going too fast on the Excel part of it, please feel free to raise your hand with Michelle or ask a question even during this introductory period, and Michelle can ask me to slow down or to repeat something. I'd hate to lose you during the early part of my presentation. The other point I just want to make is that the specific questions you asked, some of them we'll cover today. Some of them aren't directly relevant to the data that we're going to be discussing. And so while they may be good stories and good ideas, we won't be covering them during today's webinar. So I wanted to just take a minute to give you a little bit of a tour of the Ashpit website so you understand what this organization is and how it's useful to your coverage of healthcare, particularly in California. So Ashpit gathers information not just about hospitals, but also about long-term care facilities, clinics, and home health care and hospice in the state of California. Organizations and agencies and facilities are required to submit information. As you can see at the top of your, as I just moved my cursor, each different provider of care has a different tab here, and you could click on one to get to. Whoops, you can click on one to get to those agencies. The information you can expect to find is both financial data, which we won't be talking about today, and that's the dollars and cents of these healthcare institutions, how much money they bring in, how much money they spend, how much money they spend on charity care, the average cost of taking care of patients over the course of a day, and that sort of thing. We will talk about today about utilization data, and that's how much services are used in a particular hospital. And I'll click on this, and you can see the various different data types here. As I mentioned initially, the financial data. Today we'll be talking about the utilization data. There's also quality reports that are released by Ashpit, and they have quality information available. We won't be talking about those, but they're worth perusing. They release information about seismic preparedness at hospitals, and you can see whether your hospital is equipped to handle an earthquake or whether patients are going to be put in harm's way. And there's been quite a bit of coverage on this, but in light of the vast damage that's been done in earthquakes in the state of California, it's an important topic, particularly if hospitals in your community have not taken the necessary steps to upgrade their buildings. And finally, they also offer interactive maps on the website that will let you see different health statistics and characteristics within the state of California graphically displayed. I would be remiss if I didn't also note that there's an extremely helpful press office that Ashpit has. At least it's been helpful to me, and I hope it's helpful to you, Dan Burns at Ashpit. And if you go to the tip sheet I put together, it's at the bottom of that tip sheet. It says contact information, and I'm sorry, David Burns, not Dan Burns. And David has been helpful to me, and I hope he will be helpful to you as well if you have questions that I can't answer. Before we dive into the data, I thought it would be helpful to take a look at how Ashpit's information has helped shape reporter stories, because there are many, many examples of great reporting which has originated with a kernel of data from Ashpit. The first example I want to show you is the story that Christina Jewett took the lead on for California Watch, which is part of their ongoing series called Decoding Prime, which looks at Prime Healthcare, which is a major for-profit operator of hospitals in the state of California, and one that's been pretty controversial. Using the Ashpit data, they were able to determine here, I'm going to highlight this paragraph here, that Prime stands out from the perspective of patients who are admitted to Prime hospitals from the emergency room. And Tenet Healthcare, for example, admitted 39% of its emergency room patients at its hospitals, compared with 63% at Prime hospitals. Why this is important is whether or not hospitals are using sort of the emergency room as more of a cash cow than others, and whether patients are being properly admitted to their emergency room. And Ashpit data, the utilization data that we'll be talking about today, you're able to take a look and see whether or not patients are being admitted to the emergency room, at what percentage of ER patients are they being admitted, and how does that compare to the state as a whole or other peer institutions. So this is an example. I'd encourage you to read it. There are links in the different tip sheets that we have on both websites that will take you to this article, and I hope you'll take a look at that. Another group of stories is one that Jordan Rao did for Kaiser Health News and Sarah Varney did for KQED and NPR, which looked at differences in costs between different regions of the state of California. And you're able to look at this and use this by using Ashpit data. This is the financial data, which that didn't work. But if you read through the article, it talks about how the hospitals in Northern California are significantly more expensive than the hospitals in Southern California. And the data, if you click on, whoops, that's not working either. If you click on, if you read the stories, the data is coming from the Ashpit data primarily, and that's helped them to put this information in the proper context. So those, again, links are on the site. Finally, the last example I wanted to show was a recent example that Emily Baser did for CHCF, Center for Health Reporting, and this was based on a study that looked at the use of angioplasties within California and whether or not certain communities had higher rates than other communities. And today I'll show you within the Ashpit utilization data how you can actually look within that to see at each hospital how many angioplasties they perform and how many stents they implant, and the results are a little bit surprising. The other thing I wanted to show you is just the tip sheet. This should be linked on both sites, and you can, after this session, follow along with these steps in order to get to the data we'll be talking about today. So the first thing I want to show you is just how you would get to the data, and you should have gotten a link after you signed up for this webinar in which you can, with links to the data itself. And so I want to show you where you would get that. Your link took you to this page, and there's two different options that you have. The first is for the full database, and the second is for pivot profiles. And I've asked you to download both of those. Probably best to follow along with what I'm doing and download the files subsequently, but you'll want both of those as well as this link here, which is the report form and instructions. And before we look at the data itself, assuming that you've downloaded those, just to give you an idea of what it will look like when you actually do that, when you click the pivot profiles, you will see a box like this with the option of saving it or opening it, and then you would need to unzip the file, which would look like this. And then you would open the Excel spreadsheet, which I've done, and we'll look at that in a minute, but that's just how you would download this onto your computer. So then you actually have the data file on your computer. But before, sort of digging into the data, I actually think it's kind of important to understand, well, what is in the data, right? Because you can blindly look at it, but if you don't understand what it's collecting, it's really difficult for you to get a perspective for what it is that you're looking at. So this is a copy of the form that hospitals had to fill out in 2009, submitting information on their use of services. And it takes you through information about the facility, about the parent corporation, and then various information about the way the hospital is organized, what services they provide, the number of licensed beds, the number of discharges, the number of patient days, for a variety of services. So you see here the newborn nursery, inpatient beds, various categories of inpatient beds. You see information about their emergency room and the different types of emergency room services that are available there. You see information about the number of hours that the hospital is on ambulance diversion. And what ambulance diversion means is when a hospital has said that they are so full that they can't take any more ambulances, and ambulances are directed to the next facility, the next closest facility. Information about operating rooms and information about live births at the facility, information about cardiac catheterizations. So there's a whole lot of information here that you can see, and I'm going to make the text a bit bigger so that you can take a look at it. But the first thing, again, that I would advise you doing before you actually dig into that data is to take a look at this. Take a look at this form, understand what needs to be provided, and that will help you understand the column headings when we actually get to the data, and it will help you understand just what it is that hospitals have to gather. Let's go to take a look at the data. So I'm going to show you both different data sets. The first is the complete data set, which is, let me go back to the website and just show you what I'm clicking on here. That's this data set, the final database. And you notice that there's a 2010 preliminary database. I've decided not to deal with the preliminary data, although you certainly can, but to pull down the 2009 final database. So clicking this link will bring you this particular spreadsheet. And you'll see here that on the very first screen, when you open the spreadsheet, there's tips on how to deal with the spreadsheet. And then there's tabs here at the bottom for sections 1 to 4 and sections 5 to 6. And if you hadn't looked at that report, you wouldn't know what this is talking about. But going back to the report, you can see that there are sections on this report and that their corresponding field headings relate to those sections. So if you go back to the spreadsheet, you'll see here, for instance, the facility name relates to section 1, question 1.1, if that makes sense to you. And this relates to section 5, 1.1. So right now I'm not having you do any sort of detailed analysis, but rather just getting a lay of the land for what's in these different databases. The one we're going to be dealing with primarily, which is a little bit easier to deal with, is the second one. And this is the one you would locate through the pivot tables, which is pivot profiles. And by clicking on that link and saving it, you will get a screen like this that shows up. And this is the glossary tab on that page. But you'll primarily be dealing with this page, which is the pivot selection page. And what this allows you to do is pick the different hospitals that you want to take a look at. And so let's just start it off for the purposes of just taking a look at what's provided by picking a hospital. And I'm going to pick Cedars-Sinai Hospital, which you would click here and click OK. And so you've clicked Cedars-Sinai, and that's the only change you've made to this. I actually should have stopped myself because I've already done this, but you haven't. Before you've dealt with a data set, I always like to make a copy before I've done anything with it. And I would advise you to do the exact same thing. And so even before selecting Cedars-Sinai, I would suggest you make a clean copy of this and that you work off of your copy and not the original. The reason for this is, and as I was working with this data over the weekend, I made a mistake with something and it reset the data, and then I had to go back and re-download the entire file. So it's always good to have a clean file. It helps you check yourself later on, make sure you arrive at the same conclusions, that you didn't do anything that tripped yourself up. So saving a copy is critically important.